If usually at night you don't get good sleep, especially in quality and duration, good sleep is good sleep. You can do every other thing and get your money and stuff, but you must value sleep. So if you don't have good sleep, later on there is some articles that are talking about sleep also contributing to hypertension. So hi everyone, welcome back to yet another episode of Ask the Doctor here at Star Medical Center. And today we are going to tackle this episode about hypertension, because like I said in the previous episodes, that it's diabetes, it's cancer, it's hypertension, one of the non-communicable diseases that are rampant and also causing comorbidities and morbidities within our community and the country at large. So today we are going to tackle something about hypertension and or what people say raised blood pressures. So in simple terms or in layman's language, hypertension is raised blood pressure. That is actually that is abnormal raised blood pressure, and it has some symptoms. Despite the diabetes we talked about, the symptoms of high blood pressure or hypertension are not obvious, and or we say that they are not obvious, and one of maybe something that can be obvious is fatigue. So someone has had fatigue for some good time, or generalized body weakness for some good time, and you go to a health facility or center, they check, maybe you have malaria, you check all these other infectious conditions and you don't have them, but someone maybe something tips their mind and they do your blood pressure and they find it is high. So one of maybe the signs could be that a chronic body weakness, and then but otherwise the signs are not obvious for hypertension. So we usually get hypertension on regular visits and someone is diagnosed with hypertension. And so when we go to screening, who are at risk of getting hypertension? Like we said, one is the familial history. If you have a familial history, your first degree relatives, second degree relatives, or in your family you have hypertension, you stand chances of getting hypertension, and that is not controllable. I mean, like the genetic part of it is not controlled, is not modifiable. But there are some other modifiable risks that can cause hypertension. So for genetic aspect, is not modifiable. So people who are 35 years and above also stand a risk and need to be screened for hypertension, being of the African ethnicity or black ethnicity. Also, you stand a chance of getting hypertension, and having other complications or having other comorbidities that could later on bring you what we call secondary hypertension. One of that is especially people who are less or who are below 30 years now stand a risk of getting secondary hypertension. Like I said, types of hypertension, we have what we call essential or primary hypertension. There, that one we have no specific cause. We can't tell why it usually comes out. Actually, books, that's what they say. But for secondary hypertension, there is always an underlying cause. And for secondary hypertension, there is a way how we can get it. Secondary hypertension. But for primary hypertension, usually it is diagnosed in people who are above 40 years, and there is no underlying cause for essential hypertension, or is not specific. They cannot tell about it. So for essential, or for someone to be diagnosed with hypertension, this is the criteria, or this is how a doctor will tell you that you have hypertension. Usually when you walk in a facility as a client, and the doctor or the welcoming nurse will always take your blood pressure. That is, they get your blood pressure 2 readings or greater than 2 readings in an interval of 1 to 2 minutes apart. So greater than 2 readings in an interval of 1 to 2 readings apart, for anyone who has taken a rest of at least 5 minutes. So you take a rest for at least 5 minutes, they take greater than 2 readings, and those 2 readings should be 1 to 2 minutes apart. And then another thing is the device that is being used should be validated, and the cuff should be a fitting cuff on your what? On your upper arm. So it should be a fitting cuff, and the device should be validated. Now, if they get greater than 2 persistent readings that are high, or greater than the value that I'm going to tell you, then you have hypertension. You're diagnosed with hypertension. And now the other thing is to know, is it a secondary hypertension? A hypertension that is caused by some underlying thing, or it is a primary hypertension or essential hypertension that we know specific underlying cause. So the readings we usually take 2, because also it is classified under 2. We have what we call type 1, or I mean stage 1 and stage 2. So in stage 1, if you have a reading that is 130 to 139 out of or over 80 up to 89, that one we usually classify it as stage 1 hypertension. And then if you have a reading that is above 140 out of 90 or above 90, then that one we call it stage 2 hypertension. And most of our clients that come in usually have stage 2 hypertension. Their hypertension is already in stage 2 and above. So usually they don't come in stage 1. That's why usually when you come, immediately they have to begin treatment on you. But why do we usually have to tackle this hypertension? Is because according to the report by WHO or the Lancet in 2021, they said hypertension has now surpassed cancer in causing those annual global death or mortalities, because now currently hypertension stands at I think about 10.8 million deaths annually globally, and then cancer stands at 10.0, and then our diabetes stands at 1.5 million people or million deaths per what? Per year. So you can see how typically hypertension is actually overtaking in causing a lot of morbidities and death in globally, according to the WHO. So that's why we come in to tell these people, to tell you about how you're supposed to screen or how you're supposed to know yourself before it gets too late. So all our episodes are towards getting these things sink into the community, especially the lower communities, and then we get out these complications later on. So, like we said, we have modifiable risk factors that can cause hypertension, or that we usually classify them as environmental, behavioral, or genetic factors that can be related to hypertension. And later on, we also classify them under dietary and non-dietary. Maybe kuligirira omundya n'ebindi ebikushanga ngu tibikuligirira muki omundya. So one of the non-modifiable factors under non-dietary factors, we have what we call the genetic predisposition, where we say the familial history and stuff like that. If we carry those genes of having hypertension in the family, then it is non-modifiable. That means that you obviously have higher chances of getting hypertension. But we have what we call other modifiable factors. For example, the one factor is high sodium intake. So putting a lot of common salt in food. Again, you've cooked your food and again you add more salt. So you stand more risks, especially now if it is added to having that familial history, then you stand high chances of getting what? Of getting hypertension. Then foods rich in low potassium and the low carbohydrate, low potassium and low magnesium, you also stand a risk somehow, but that is also modifiable. You can do something about that. Alcohol intake. Then we have low calcium intake, and then we have low diet quality. All those ones are related to, or they can predispose you to getting, if you really have the genes of having hypertension, you can also, they increase your chances of getting hypertension. Then some of non-dietary, we have what we call psychological issues or stress. These stressors of every day, maybe these heartbreaks in relationships, work-related issues. So they can later on also predispose you to getting this hypertension. And then we also have low physical inactivity. That's why always you see people every day in the morning, people are down running, jogging. So they are trying to a little bit to make their body come to activity, and they avoid inactivity because it is also related to somehow, somewhere contributing to hypertension. And then we have overweight. You can do something about the weight as well. So if your weight is abnormal, you also stand more chances of getting hypertension. Also, we have lack of sleep. If usually at night you don't get good sleep, especially in quality and duration, good sleep is good sleep. You can do every other thing and get your money and stuff, but you must value sleep. So if you don't have good sleep, later on there is some articles that are talking about sleep also contributing to hypertension. So some of the complications hypertension brings, there are so many, and the very first one are the cardio or cerebrovascular related issues. So issues dealing with blood vessels, supplying to the brain, supplying to the vital organs in the body, the brain, the heart, the kidneys. So if you have hypertension, it somehow contributes to having these high cholesterol, lipids, and then plaques within into your blood, or even your vessels trying to become stiffened because of the high resistance, and then you get poor supply of blood into these body vital organs, and then you end up getting now this end target organ damage. So when you get this end target organ damage, you start getting issues like hypertensive retinopathies, then you have CKD, chronic kidney disease, and then you have these things of MI, myocardial infarctions, then you have acute strokes or chronic strokes. So all these things happen because of uncontrolled high blood pressures. And also to notice is that out of the 5 patients that access facilities, only 1 patient has controlled blood pressures. So you can check also that gap. And the reason is because these people approach the facilities when they already in stage 2 of hypertension. So if we can now go to the management of hypertension, hypertension management also depends on the stage, like I've said, and also it depends on the stage, and also depends on what the patient really wants, or the complications that you have gotten already with the hypertension. So especially in stage 1, where I said that the blood pressure readings usually are in 130 up to 139 over 100, over 80 up to 89. So with no any other risk factors. So that one can be usually controlled via our lifestyle modification. If you're taking alcohol, we tell you to regulate on the alcohol. If you're used to driving and you don't walk, sometimes we ask you to do some walk, do some jogging. That physical inactivity, you remove it. Reduce on psychological stressors. You reduce on taking these sweetened things, because all that we are trying to remove the risk factors that are contributing to the hypertension. And then when you're in stage 2, that's already automatically qualifies you to getting to treatment. And then the treatment as well, we usually use combination drugs, because you already need more than one drug to control your hypertension. And then we also encourage adherence to this treatment. Like I said in our episode of the diabetes, hypertension can be controlled so that we avoid complications or severe complications ahead, especially in our late ages. So when we control this blood pressure from the beginning, then at the end we don't carry these risks of dying or succumbing into complications of hypertension. So adherence is very key to the medication, and regular visits or regular reviews on these patients, or on you yourself taking this as an initiative to go and start screening up and doing what the doctor tells you, will help you get out of the complications of the hypertension. So when it comes, now you have to live with it. Learn how to live with it and learn how to take the medications and also the adjustments that the doctor will have told you talk about. So the most now the most trending scenario maybe now on social media is I am selling my 2 kidneys, and then someone is telling you that you can't sell the 2 kidneys, you will die. You hear people saying that now I want to get rich through getting the kidneys. So the reason why this kidney, the thing is trending, is because of the number of people who have CKD and are demanding for kidney transplant. And the most leading, also one of the leading causes of CKD is hypertension, second to diabetes. So if we control these things, then we are likely not to get issues with our kidneys ahead. And so if we can try to control our blood pressures, take the medications the way we are told, and also screening up, especially for these end organ damages, we can control this blood pressure. So one of the screening things also when you go to the facility is that they do the screen up of your end organs, the kidneys. They will do your urine, they will do your LFTs, liver functional tests for the liver, they will do renal functional tests to check your kidneys, they will do urine, they will do something dealing with the heart, so that they can screen all up and they see that your vital organs are working very well and towards achieving, and they see then how they will be managing you sequentially, so that we don't get these complications ahead. So that's briefly something about hypertension, and majorly on essential hypertension. For secondary hypertension, that is also another big topic that requires another episode that we can talk about them, especially the hypertension that is diagnosed within the young people, or yes, the young people less than 30 years. We call it secondary hypertension, and usually that has a secondary cause, of which we can tackle later on maybe in our episodes. Yeah, so we want to thank you for usually watching our episodes, and we hope to continue giving you all this guidance. But remember to always come and check yourself, come and do these screen ups, so that we can have a life that is free of complications later on in our late ages. So thank you so much. I remain Dr. Silva. Hope to catch you in the next episode. Thank you.